So far, we've looked at how stories can educate, engage, and influence. But how do we know if our stories are having the desired impact? This is where measurement, evaluation, and learning, or MEL, comes in. MEL is key to understanding our successes so that they can be replicated. It also helps us to understand what could have been done better so that we can make changes to future storytelling projects. Additionally, MEL can help donors, partners, and other stakeholders see the value of our work and garner support for future storytelling projects. Let's look at some basic steps and techniques for measuring and evaluating stories. 1. Revisit your SOCO. Revisit the single overarching communication outcome that we worked on in Chapter 2. For example, in Haitang Story, the SOCO is that viewers understand the risks of COVID-19, especially for frontline health workers, and the impact on the families of those infected. 2. Establish your baseline. A baseline is the starting point from which you measure change. It may be an audience's current knowledge, attitudes, and practices, also known as CAP. To establish a baseline, think about the topic in your SOCO and explore these CAP indicators. What does the target audience know about the story topic? What are the attitudes and beliefs of the target audience about this topic? How is the audience currently behaving in regard to this topic? Where possible, the answers to these questions should be informed by data. For example, when developing Haitang Story, we could collect data to understand our audience CAP by answering the following questions. For knowledge, what does the audience know about the health risks associated with COVID-19? Regarding attitudes and beliefs, how likely does the audience think it is that they or their families will be affected by COVID-19? And for practices and behaviors, how well are audience members following protective measures like wearing a face mask and physical distancing? Let's zoom in on the attitudes part of the baseline and image that a survey conducted by a local public health organization shows that only 20% of people in our target audience believe COVID-19 can be very dangerous for their health. This statistic can inform our baseline. We know that we want to increase this percentage among people who see our story. Define your SMART objectives. We cannot usually expect to change health behaviors through a single story, but great stories can influence knowledge, attitudes, and practices to some extent. It's helpful to be specific about the influence we are trying to achieve by using SMART objectives. SMART objectives are specific. The objective states numbers, percentages, dates, and details. Measurable. The objective has concrete aims and a clear way to measure and evaluate success. Attainable. The objective is likely to be achieved within the time frame. Relevant. The objective aligns with overarching organizational objectives. Timed. The objective has a clearly stated target date or deadline. What are some SMART objectives you'd like to achieve for your project? For example, in developing Haitang Story, one SMART objective might be, after watching the video, 50% of viewers respond that infection with COVID-19 can be very dangerous to their health. Use your handbook to write down some SMART objectives for your storytelling project. Develop a program logic model. A program logic model is a planning tool that will help you define the steps you need to take to reach your SMART objectives. You can find a template of this model in Chapter 5 of your handbook. The next steps help us to fill in the program logic model. Identify your indicators. Indicators help to measure whether our storytelling is effective and if we are meeting our objectives. They should be identified and collected at each stage of your activity and can draw on both quantitative and qualitative data. In Haitang's story, we want 50% of viewers to believe that infection with COVID-19 can be very dangerous to their health. How do we measure whether or not our story achieves this? A viewing panel could be one way. Viewers could be asked about their beliefs about COVID-19 before seeing the video and then again after. In this case, the indicator is the change in the percentage of people who respond that COVID-19 can be very dangerous. Collect your data. You've already collected some data in step 2. Establish your baseline. As you develop your story and/or at the end of your project, you should collect another round of data to monitor your progress. Some data collection methods include focus groups, viewing panels, surveys, and analytics. Now you are ready to create your program logic model. See Chapter 5 of your handbook for more details about data collection methods and a program logic model template. Analyze your data. Here's where we evaluate and learn from our work by gathering insights from your data collection efforts and reflecting on the following questions. What specific changes were you able to achieve according to your data? Did you meet your SMART objectives? What challenges did you face? What would you do differently next time? You should compile your findings into a simple report or presentation so that they can be easily shared with relevant stakeholders like partners or colleagues. Refer back to your report next time you are starting a storytelling project so you can learn from your experiences.